হ্যালো গাইস, ওয়েলকাম টু মাই চ্যানেল নাদিনীস ম্যাথস ক্লাসেস। সো আজকে আমি আলোচনা করব হোয়াট ইজ হাইপারটেনশন, ক্লাসিফিকেশন অফ হাইপারটেনশন, টাইপস অফ হাইপারটেনশন, clinical manifestation of hypertension and diagnosis of hypertension, management of hypertension, and what are the complications we can see in the hypertension. So let's start the video. So what is hypertension? Hypertension or high blood pressure, right? Hypertension, also known as high blood pressure, is a condition in which the blood pressure in the arteries is chronically elevated. Means in the hypertension, what will happen in the arteries? The blood pressure become increase. Okay, and hypertension is defined as an average systolic blood pressure above 140 mmHg and a diastolic blood pressure above 90 mmHg. Normally what the blood pressure is 120/80, right? So if the blood pressure become 140 mmHg in systolic and diastolic blood pressure 90 mmHg or above is called as hypertension, or both are over a sustained period is the hypertension. So once again, hypertension or high blood pressure is a condition in which the blood pressure in the arteries is chronically elevated, means increase. Hypertension is defined as an average systolic blood pressure above 140 mmHg and a diastolic blood pressure above 90 mmHg, or both over a sustained period. Okay, is called hypertension. Next topic, classification of hypertension. So classification here, they dividing 4 classification. First one, normal blood pressure, then pre-hypertension, then high blood pressure stage 1, then high blood pressure stage 2. So in the normal blood pressure, systolic blood pressure is less than 120 mmHg and diastolic is less than 80 mmHg. And here in the pre-hypertension, systolic blood pressure 120 to 139 and diastolic is 80 to 89 mmHg. And high blood pressure stage 2, systolic blood pressure 140 to 159 and diastolic is 90 to 99. And high blood pressure stage 2, here the systolic blood pressure is higher than 160 and diastolic is higher than 100. So these are the 4 classification of hypertension or blood pressure. Types of hypertension. Hypertension is 2 types, primary and secondary, right? So primary hypertension is the most common form of hypertension. Almost 90% cases, almost 90% people are affected by primary hypertension. So it mainly occur due to unhealthy diet, increased salt intake, tension, stress, smoking, lack of exercise, and obesity, excessive consumption of tea and coffee. Okay, so primary hypertension is the most common form of hypertension. And then secondary hypertension. Secondary hypertension tends to appear suddenly and cause higher blood pressure than primary hypertension. Okay, and it mainly occur due to renal parenchymal disease, narrowing of renal arteries, pregnancy, oral contraceptive pills, pituitary or adrenal gland tumors. Okay, clinical manifestations of hypertension. So what are the clinical manifestation we can see in the hypertension? First, high blood pressure, then severe headache, dizziness, blurred vision, then nausea and vomiting, then fatigue and confusion, then epistaxis or nasal bleeding, then chest pain and shortness of breath, then irregular heartbeat, then heart attack and heart failure. These are we can see in the chronic hypertension. Okay, heart attack and heart failure, stroke, kidney failure, eye damage with progressive vision loss. Okay, these are the clinical manifestations we can see in the hypertension. Next topic, diagnostic evaluation. So what are the diagnostic evaluation in the hypertension? First one, complete blood count and urine analysis. Okay, and next chest X-ray, then electrocardiogram by ECG, and then echocardiogram or ultrasound of the heart, and then Doppler ultrasound. Complications of hypertension. Uncontrolled high blood pressure can lead to heart attack or stroke. Aneurysm means ballooning of the arteries, arterial wall, then heart failure, thickened and narrowed or torn blood vessels in the eyes, weakened or narrowed blood vessels in the kidneys, and metabolic syndrome. So these are the complications we can see in the uncontrolled high blood pressure. Next, medical management of hypertension, or what are the treatment we can give to the hypertensive patient, right? First one, diuretic. Diuretics decrease the volume of blood in the body and lowers the BP. So we know that hypertension means increase the BP, right? So for this reason we can give diuretics. Diuretics decrease the volume of blood in the body and lowers the BP. As a example of diuretics, like furosemide, okay, furosemide 40 to 240 mg per day we can give. And next, beta blockers. Beta blockers can reduce the workload on the heart and open the blood vessels and causing heart to beat slower with less force. Okay, and that may lead to decrease the blood pressure. So for this reason we can give beta blockers. As the example of beta blockers, like propanolol, and this is 40 to 480 mg per day we can give. Okay. And next, alpha blockers. Alpha blockers can reduce the nerve impulses to the blood vessels and reducing the effects of natural chemical that narrow the blood vessels. Example, prazosin. Prazosin 2 to 30 mg per day we can give. And next medicine, alpha beta blockers. It slow the heartbeat to reduce the amount of blood and that must be pumped through the vessels. Example, levetolol. And 2 to 30 mg per day we can give. And next medicine, vasodilators. Vasodilators as an example, hydralazine 50 to 300 mg per day we can give. And next, ACE inhibitors. These can relax the blood vessels, like captopril 25 to 150 mg per day we can give. Next, calcium channel blockers. These can relax the muscles of blood vessels. Okay, so as an example of calcium channel blockers, like nifedipine 30 to 120 mg per day we can give.